Welcome to Fostering Ringworm Pets. This material was created for Seattle Humane foster parents. So what is ringworm? Ringworm is a skin infection that is caused by a fungus. It's not a worm. The mark that ringworm leaves on the body is called a lesion. These lesions usually appear 5 to 12 days after infection. Ringworm is contagious to other animals and humans and can live in an environment for up to 20 months. Despite this, ringworm is most often seen in animals with poor or immature immune systems. Since shelters are inherently stressful places, all shelter pets are increased risk. Why foster ringworm? Pets with ringworm often have no other issues and they feel great, but because of the contagious nature of their infection, they must be housed in isolation at the shelter. This is a bummer for both the infected pets and the staff. For young pets, this can mean that they grow up in a cubby and miss out on crucial socialization. For staff, ringworm treatment in the shelter is time and labor intensive. While we provide high quality care and enrichment, living in a cubby or a kennel is just not fun. And stress can make it harder to recover. The best place for a pet is in a home. That's where you come in. By sending a pet to foster, you can decrease the pet's stress, which can lead to a quicker recovery. For foster to adopt foster parents, you're going straight to the front of the line for adopting a shelter cutie before other folks. Ringworm foster parent Sally says, I began fostering cats with ringworm nearly 4 years ago and quickly realized how important it is to foster them. Since it's contagious, the cats and kittens stay in isolation at the shelter if they aren't fostered. They're well taken care of, however, the kittens especially need more socialization than they can get there. Ringworm foster parent Colleen says, after volunteering for a few months in the isolation ward at Seattle Humane, and understanding that it can take weeks for them to clear, I knew that I could offer a loving room in my home for a cat or kitten with ringworm. The cat or kitten is able to have space in a room, toys with which to play, and consistent, loving human interaction. Considerations for fostering. You'll be doing a lot of laundry, so you should have easy access to a washer or dryer. If your pets or people in your household develop ringworm, Seattle Humane can't diagnose or treat it. If you have ringworm in your home, you can't foster for 3 months unless you took all ringworm housing and sanitation precautions from the outset. The hardest part will be sticking to the confinement. A solution is putting a chair in the bathroom and watching a movie on your phone or tablet while you keep the pet company. Just make sure the phone or tablet's in a Ziploc bag so it doesn't get contaminated. You'll need to come to the shelter weekly to drop off test material. If you can't follow all the rules or don't have the right home setup, ringworm fostering isn't for you. That's okay. There are other cases that need your help as well. All right. Let's look at some lesions. See, it's not that gross. Ringworm can present in different ways. Whenever hair loss is discovered in shelter pets, we examine it to determine whether it's ringworm. For cats, we often see ringworm lesions on toes, ears, and face, but it can be other places as well. For dogs, it's less common in the shelter, but it can be present in any place on the body. For humans, ringworm is more obvious, but luckily treatment is pretty easy. It often shows up in places where there's friction and moisture, like waistbands and watch bands. It's similar to the athlete's foot, and the treatment is often the same, but you should see your own doctor. Methods for testing. There are 3 methods for identifying ringworm. These are Woods lamp, PCR test, and DTM culture. For the Woods lamp test, that test is done in-house by staff using a medical-grade black light. The results are determined immediately, and the pet's entire body can be examined. However, it cannot detect all types of ringworm, so even if it's negative, we may still do another test. The PCR is a test that Seattle Humane sends off to a lab. We usually get the results in 3 to 5 business days, and it tests specific hair follicles that are collected from the lesion. The DTM culture is the test that we run in-house. It uses spores collected from the pet's coat and lesions. For the Woods lamp, the test is done by running a medical-grade blacklight over the hair coat of the pet. From this, you can identify some, but not all types of ringworm. A candy apple green glow is indicative of ringworm. You should not try to identify ringworm at home using your own blacklight. All pets that come into Seattle Humane are wood slamped during their intake assessment. The PCR test is done by sending hair follicles pulled from the lesion to a lab. The DTM culture is the part that you'll be helping with. Every 7 days, we start a new culture for the pet, so every 7 days, you'll need to collect a new sample and bring it to the shelter. By brushing the pet with a toothbrush, then tapping the bristles in the agar, you create a culture. This then is put in an incubator and monitored for growth. This is quite simple to do, but we'll show you how to do it in an upcoming video. Okay, there's 4 types of cases you may interact with as a foster parent. We will always tell you if your foster pet is one of these types of cases. First, ringworm positive. These cases have been diagnosed positive and are undergoing treatment. To clear a positive diagnosis, a pet needs 2 negative consecutive DTM cultures. The next type is suspect. These cases are suspicious for ringworm, but it's under investigation via further testing. From here, a PCR test either determines if the pet is positive or negative for ringworm. There are also 2 types of exposure cases, which are determined by how closely the pet was living or housed near a positive or suspect pet. For direct exposure pets, they were co-housed with a positive or suspect pet. These are resolved by 1 negative DTM culture. Indirect exposure cases were housed near or transported with a positive or suspect case. These are resolved by one wood slamp test in the shelter, and then are given a lime dip and a waiver for adoption. There are 3 types of ringworm. Microsporum canis is the most common. Trichophyton mentagrophytes does not glow under a wood slamp, so we may miss it at intake assessment. Supplies. If you're fostering ringworm, we'll send you home with all the normal supplies you might need and all the special ringworm necessities. You'll get dip solution, medications, towels, litter box, rags, coveralls or gown, toothbrushes for cultures, gloves, and rescue cleaning product. Please remember to return everything that is able to be reused to the shelter once you're done. We will sanitize it and reuse it. What to wear. Since ringworm is contagious, wear clothes that you can launder along with other contaminated items in the room on dip day. Keep your hair back and your skin covered. Sweatpants or pajamas, a long sleeve shirt, socks or pajamas, socks or slippers, gloves, and a washable yellow gown are comfy options. You can ask to borrow a pair of gray coveralls from the shelter as well. Housing and containment. Choose a room that can be easily and completely cleaned. Bathrooms are best. You can also use a large wire crate for housing, but they still need to be in a room that can be decontaminated. Now we'll cover the 3 facets of ringworm care. These are retesting, medication and treatment, and environmental decontamination. Just look how much fun this awesome foster parent is having. Retesting. Pulling a DTM culture is easy.
So these are the supplies you'll need when you're pulling your ringworm cultures at home. A toothbrush that's prepackaged here, a clean Ziploc bag, and a permanent marker to label the bag with the kitty's name. What you'll do is you'll first just take this toothbrush out of its packaging. When you're brushing the cat, you will want to end with the areas where ringworm is most likely to be present. So that's the face, ears, and feet. And then especially you'll end at any areas where there are crusty lesions present so that you're not spreading spores around the kitty. So we'll start with the trunk of the kitty first. So we'll brush the back, and we'll want to get at least 30 good brushes to get good hair samples to put on the culture plates. Now we can move on to the feet. samples from the feet, so now we'll move on to the face. This kitten doesn't have any obvious lesions for us to end on, so this will be the last spot that we get our sample from. Now we'll just place this in a clear or fresh plastic bag. We'll write the name of the kitty on here. And we would use a disinfectant spray just to spray down the bag because it's contaminated from us touching it. And then you're good to go.
Medication and treatment. The goal here is to stop the infection from both the inside and the outside of the pet. There are 3 parts to this: an oral medication called terbinafine, which is given daily by mouth, either in tablet or liquid form, and for some pets, a topical medication called miconazole, which is applied to the lesions. This is the same ointment that's used to treat athlete's foot in humans. Finally, a lime sulfur dip is a bath that is given to the pet twice a week. In the shelter, we do Wednesdays and Sundays. Lime dip smells like sulfur, so if you're having a hard time with the smell, pretend you're in Yellowstone. It's like you're on vacation in your own bathroom. Now let's talk about dips. Prepare by putting on your coveralls or your yellow gown and gloves. Prepare your crate or carrier for the pet to go and post dip. Get your towels and rags handy, and then prepare your dip solution. You're going to add 4 ounces of lime sulfur concentrate to a half gallon of warm water. Gently place the cat or kitten in the water. If the cat won't tolerate standing in the 1 inch of water, or if you're doing a dip for a dog, they can stand on a towel. Using a sponge or small rag, wipe the pet's entire body thoroughly. Pay special attention to the paws, ears, and face. Gently pat the cat with a dry towel. Place the cat in a clean carrier with clean bedding. Kittens should also have a snuggle safe, which is a warming disc that can keep them warm when they're wet. Now we'll watch a video. Next step, environmental decontamination. The goal for this step is to clean the room so that the freshly dipped pet is going back into a clean room. After the dip, sanitize the room by removing and laundering all fabric items and washing all toys, litter box, and dishes with bleach. You can use a ratio of 1 to 10. Remove loose materials from the floor and shelves and spray with rescue cleaner. Allow to soak for 10 minutes before wiping. Reset the room with clean items and let the pet out of the carrier. Setting a schedule is helpful for staying on track and not missing a treatment. You can see the sample schedule that there are 2 days that require the most work. Even on the busier days, the care will probably not require more than an hour of work. But remember to factor in the time driving to this shelter where you have to drop off the sample once a week. Ringworm foster parent Colleen says, "It's contagious but easily treatable. Establish a room, a set of supplies, a schedule, a set of systems, and the process for clearing a cat or kitten of ringworm is really easy. I have a room in my house and a set of ringworm clothes which I wear at all times when I interact with my ringworm positive fosters. Ringworm can take time to clear, but during that time I get to enjoy the company of these sweet animals while medically helping clear them of their infection." Completion adoption. Once the pet has cleared ringworm, yay you, they can continue their journey to adoption. Make sure to thoroughly decontaminate your foster room. Spray with rescue, allow to soak for 10 minutes, 2 to 3 times. For foster to adopt foster parents, you can adopt once any pending procedures or tests are completed. Please return all foster supplies in a clearly marked bag. Thank you.